Hello, and welcome to the Chapter 14 and 15 CAM Therapy and Cancer Management point. I want to make sure you guys know to review the key terms for both Chapters 14 and 15, and they're listed within your PowerPoint for you. All right, so cellular regulation here is the process of cellular responses in order to undergo reproduction, differentiation, and proliferation. This is how we're going to be able to understand the difference between healthy cells or normal cells and cancer cells. The scope of the concept here is understanding optimal cell growth and reproduction, which would be a normal or healthy cell, versus the uncorrected errors in cellular growth resulting in neoplasia, so problems that result in cancers. So an overview here, we're looking at a group of disorders that are characterized by abnormal growth and spread of cells. We see an incidence number of new cases reported by the American Cancer every year, and the numbers continue to grow. We do see changes in the different types of cancer, but we do continue to see an increase in the number of cases being reported each year. For mortality, there's 1 in 4 deaths attributed to cancer, and 3 contributing factors: hereditary, environment, lifestyle, and I think we should also add in there advancing age. When we're looking at what a cancer cell includes, we're looking at abnormal mass of cells, and they can be benign or malignant. But cancer cells specifically are poorly differentiated, have abnormal chromosomes, migratory, cohesive, and aneuploid. So with that, they're having mutation results in the chromosomal number, so that number of chromosomes is abnormal. So a normal or healthy cell would have 23 pairs, which equals 46 total chromosomes. For incidence, kind of to run back to that one, the key points there: breast cancer is the most significant for females. Prostate cancer is the most significant for males. And as we added aging to our topic of the contributing factors, this has a direct effect on cancer. So the longer that one lives, it increases the risk for cancer. And this is because there's a decrease in the immune response within the system, and there's also the length of exposure that there's been to carcinogens throughout the life. We need to understand also that it's different by country due to the environment and lifestyles. So the United States is going to have different numbers for incidence and mortality than other countries throughout the world. So cellular basics, we have normal and benign. Normal cell growth, we go through division and mitosis, only occurs when cells need to be replaced because there's a programmed death or injury. So the cells have a typical life cycle, and as it goes through that, there's division or mitosis that will occur at certain times during that normal cell life. They exhibit contact inhibition, so when they're in a confined space within the body, they will prevent themselves from reproducing further. And they secrete fibronectin and stick to cells within the tissue. Benign cells continue with cell division, but at a wrong rate, time, or location. They tend to be surrounded by fibrous capsule, and they do not spread by invasion or metastasis, but they can still cause pain, obstruction, or seizures. Whereas malignant cell growth, which is linked to cancer, goes through 4 different stages: initiation, promotion, progression, and metastasis. And there it's uncontrolled and unregulated cell division, divide at a high rate with no regard for normal mitotic limitations. They're going to invade other tissues and metastasize. They can secrete enzymes that contribute to abnormal interactions with nearby tissues, allowing the invasion of malignant cells. So with metastasis, which is the last one on there, we talk about the spread of malignant tumors from one location to another, and they typically follow a blood or lymph path or invade adjacent tissues. So we had talked a little bit about in class, but rectal and prostate typically metastasize to the lungs, where colon typically metastasizes to the liver. Angiogenesis here, related to malignant carcinogenesis. Basically, angiogenesis talks about that it develops its own blood supply. So cancer cells provide nourishment and oxygen through angiogenesis. Physiology and pathophysiology, we look at classification and staging of tumors. We use the TNM system for staging. So we talk about T, meaning the primary tumor, where their T0 would be no evidence of a primary tumor, where T1 to 4 is talking about an increasing size or local extension of the primary tumor. N refers to nodes or regional lymph nodes, NO meaning no regional lymph node involvement. N1 to N3 means that there's an increase or extent of regional lymph node involvement. M is metastasis, so distant metastasis. MO, or M0, sorry, I should be saying 0, means no distant metastases, and M1, distant metastases present. If you ever see an X after any of those, it's talking that it just cannot be assessed at this time. So it may be that it's difficult to assess because of limited testing ability, meaning it's difficult to locate, difficult to find, or by looking for it, it could cause other damage or problems within the body, or that maybe that type of radiography is just not producing the results that you need to understand exactly where or how much or how large a tumor is. Grading, on the other hand, is done by a pathologist with a biopsy. So basically what they're looking at there is the differentiation, or how it looks under the microscope. Is it specialized or not? We grade things on a scale of 1 to 5, and as the grade increases, the differentiation decreases, meaning that the cell becomes less specialized. So less like a normal muscle tissue, less like a normal cardiac tissue. So differentiation, we're talking about specialization, or what that cell was originally supposed to be doing. And so as it becomes more and more involved, increasing by grade, that differentiation decreases, so it's less like the specialized normal cell. So here's an example so that you can kind of practice reading what they would be looking at. So T1, N2, M0. So kind of just go through and see if you can determine what those each mean. Individual risk factors include smoking, poor nutrition, excess weight, sedentary lifestyle, exposure to environmental carcinogens such as sunlight, pollutants, and then medical treatments such as medications or radiation. Genetics plays a large component in this. So if it runs within someone's family, they're at a higher risk for having certain types of cancers. Certain cancers are more likely to be passed down from one family member to another, and then advanced age. That also increases one's risk for developing cancer, and we've already spoken about why that is. So when you look at these, we look at smoking cessation, eating a low-fat diet, increasing or improving one's nutrition, encouraging exercise, trying to get away from that sedentary lifestyle and gaining excess amount of weight, and then limit the amount of exposure if possible to carcinogens within the environment. Genetics, there's not a whole lot we can do about that, but people do go through genetic testing so that they can possibly prevent, say through a bilateral mastectomy that they're doing to prevent the development of breast cancer and such. So, and then advancing age, again, not a whole lot we can do about that one. Caution is the acronym that we use to discuss the warning early signs of cancer. So we talk about a change in bowel or bladder habits, sore that does not heal, unusual bleeding or discharge from an orifice, thickening or the presence of a lump, ingestion or difficulty swallowing, obvious change in a wart, mole, or nevus. Nevus is like a birthmark or another mole. N is a nagging, cough, or hoarseness. So when we see obvious changes, say in a mole or a nevus, that would be a warning sign that would, as a nurse, push me to do further investigation or assessment of what's going on with the patient. Next we look at prevention. Primary prevention, we're talking about the use of vaccines or health counseling to reduce risk factors. So this is generalized for anyone within the public. We look at avoiding smoking, talking about sunscreen, limiting ingestion of alcohol or drugs, with our diet increasing vitamins, fiber, nutrients, and antioxidants, decreasing the amount of calories, fat, and red meat consumed, encouraging regular exercise, and then guarding against exposure. So safe sex to prevent against STDs, what we can do to prevent exposure to radon and other gases, and then also other chemicals. Secondary prevention, we're looking at the warning signs of cancer, and with this we're going to follow the screening path that's usually set by the American Cancer Society, and we're looking at early detection. So screening guidelines that are based on sex, age, and identified risk factors. So if someone has a genetic disposition for a certain type of cancer, that may increase or cause them to need to get checked earlier in life. Make sure you review Table 15-3 to review what those different stages are as far as the screening guidelines. And finally, tertiary. This is aimed at minimizing side effects, reducing disability, increasing maintenance function, and then preventing the reoccurrence. So strategies for health counseling and chemo prevention. We're going to be focusing on diet, exercise, avoiding exposure, and improving one to have a better or healthier lifestyle. Chemo prevention, they're going to incorporate drugs, foods, and other agents to decrease the risk and reoccurrence of any types of cancer. Tamoxifen is one drug that they may use, and this is going to reduce the risk of breast cancer after cancer surgery. It's a synthetic hormone that is protective, but it does have risks associated with it, such as endometrial cancer, stroke, and blood clots. And then this risk can be increased when they're using other medications such as aspirin and NSAIDs. Diagnostic tests that are used for cancer. We're doing different types of laboratory tests. So here I'm looking at different tumor markers, and these are substances that are expressed by the tumor or by normal tissue in response to a tumor. So for example, PSA, which is the prostate-specific antigen. This increases with BPH or prostate cancer, and it's used to screen for cancer, but also to determine one's response to treatment. So if we see, if they check the laboratory test for the PSA and it's high, and then they go through after treatment and they reassess that PSA level, and it's decreased, they would determine that the treatment has been effective. So it's used in assessment, monitoring for treatment, and diagnosis of reoccurrence. Then we have CEA, which is the carcinoembryonic antigen test, and this measures the amount of this protein in the blood with certain types of cancer, such as colon, rectal, pancreas, breast, and lung. And again, they're going to be looking to see if this is, for assessment, monitoring, and then diagnosis with reoccurrence. Next we have radiographic tests, so CTs, X-rays, MRIs, bone scans, PET or ultrasound. Biopsy is next on the list, and there is going to be removing a sample of the tissue. This is definitive diagnosis and is accomplished only through histological or cytological proof. So again, the biopsy is done to talk about the grading for cancer. So they can do needle biopsies, surgical biopsies, bone marrow aspiration, knowing that there are complications, and that includes infection, hematoma, and pain. With surgical complications, we can also have problems with bleeding, and then again, infection and pain. With bone marrow aspiration, they're looking at a core needle, so there's a hollow needle that they're going to be putting in, and they're going to take out, remove a sample of the bone marrow, and then with the bone marrow aspiration, so aspirate that. And then again, take a look at that under the microscope. Complications with this can be hemorrhages and infection. Clinical management goals, so treatment goals and strategies depend on the characteristics of the neoplasm and overall condition of the patient, and treatment wishes of the patient and family. Treatment goals can be curative, control of disease, or simply palliative, meaning we're trying to ease the symptoms and maximize the quality of life when there's no cure possible, or the extreme measures to cure the patient is beyond what they're wishing to do. So again, following that treatment wish of the patient. Treatment goals can be changed as the disease progresses, but different things that they can be doing are radiation, pharmacotherapy, chemotherapy, and surgery. Treatment depends on the cancer site, type, disease progression or spread, and individual patient response. An example for just kind of care and everything afterwards, if someone has a lobectomy, so they've gone through the surgery, they may be following up with further radiation or chemotherapy to continue to shrink the size of a tumor. But we always want to make sure that we're continuing to promote just our normal postoperative cares when it comes to surgery. So encouraging your patient to use their incentive spirometer or to do their turning, coughing, deep breathing, to continue to remove air through the remaining lung or remaining lobes. For a bone marrow transplant, we want to make sure that we're anticipating what types of side effects they might have from that experience. So it's very common that someone would experience nausea, vomiting, fatigue, and skin reactions. But just to understand that these are short-term, but we can still try and work with the patient to try and decrease or minimize the amount of side effects that they're experiencing. Make sure that you would be able to explain to a patient what is radiation, what does it mean exactly. What is chemotherapy? So with chemotherapy, we're looking at preventing cell growth and replication, understanding that chemotherapy is going to be directed at both normal cells and cancer cells, and so it's not as specific as radiation where they can really focus on targeting a specific location within the body. And then surgery, again, also really focusing on a specific point there. So they choose different types of treatments based on what the goals are and basically what type of cancer is, where is it located, what are the prognosis for it. So between the caregiver and the patient, physician and patient, they can determine what would be the best plan for that patient's goal. When we're talking about planning and implementation with surgery, there's different principles of treatment. We can be diagnosing, so we can be doing it for diagnosis, for biopsy, we can do it to remove. We can insert different types of hardware that can be associated with it, and focusing really on relieving discomfort. We want to focus on preoperative management, postoperative management, complications, and then long-term implications. So with pre-op, really discussing pre, peri, and postoperative surgery experience and what are their expectations. So if they're really concerned or worried, really asking them, what are you concerned about? What are your expectations? Have you experienced something like this before? But really asking them and trying to work with therapeutic communication with that. Postoperatively, really working on pain control. Even if someone has had a history of narcotic abuse, when it comes to cancer, it really doesn't matter at that point. We are going to try and treat the pain that they're experiencing and do the best possible care that we can possibly to help manage that. So if they have a PRN that's prescribed, go ahead and give it. Okay? We really don't want to be too concerned about history of narcotic abuse. Let that physician be concerned about that. Make sure the physicians are aware of it, but you'll want to make sure that you are treating pain appropriately. With postoperative, we're also going to encourage exercise to support pulmonary gas exchange, again, working with the incentive spirometers and then doing the coughing and deep breathing exercises. We understand with all of this, we want to focus on nutrition also, supporting the immune system, supporting the wound healing process, using aseptic techniques, and then promoting the wound to heal with proper drainage and dressing changes and care. Other complications that people can experience are alterations in bowel elimination, fear, anxiety, and infections. And then long-term implications, observe for any complications, promote comfort, and prepare for diagnosis. So always be talking about them, what to expect and what is the next path or what is the next plan for treatment. And really focus on what could be happening with them emotionally and mentally, thinking about body image changes. So hair loss, weight gain, fatigue, anything that goes along with any changes that they may be experiencing. Outcomes here, what we're looking for, sorry, I'm kind of jumping ahead on this. We're looking for cure, long-term remission, or just improved comfort. Again, looking at, is this palliative? Are we looking for a cure? What is our overall goal for the plan? Moving to the top of this slide, external and internal. We talk about teletherapy and brachytherapy. So here we're using high energy ionizing rays to damage or kill cancer cells by preventing them from growing and dividing. This is a localized treatment because only cells in the area are being treated or targeted. And then they may also include areas with common metastasis. External teletherapy, it's high energy rays directly to the tumor from a site linear and external from the body, where brachytherapy is an internal type of treatment, and this is implementation of small amounts of radioactive material in or near the cancer cells. So they can do low dose, high dose, or permanent implants. And so just to learn about different types of brachytherapy, you can look at table 15-4. Understand that brachytherapy can be given by IV, oral. They can be seeds that are implanted, or rods, or catheters, or wires with this. Treatment planning, we have to understand when is it safe to be around the patient or when is it not. Also teaching them about what's going on with their body, so changes related to radiation. So they're going to go to a treatment planning session, and with this they're going to be hooked up to a simulation type of machine where they're going to have their skin marked and their x-rays are going to be taken. Any of those stickers or X marks or permanent marker or tattoos there, please understand, obviously tattoos you're not going to try and remove, but anything else there, do not remove the markings or the stickers or whatever on the body. These are specifically placed so that they know exactly where they're supposed to be targeting. So you need to make sure that you explain that to the patient too, that they're not removing anything. And then they're also going to have immobilization devices made during this time, and then different blocks or shields. This entire process is safe and painless, but it's just making sure that they really individualize the plan of what's going on with that patient. So looking at radiation, so external treatment, side effects here, nausea, vomiting, abdominal pain, cramping, watery stools. Fatigue is another big one. Skin irritation such as burns and swelling. Make sure any burns of the skin that you are not applying an oil-based lubricant like Vaseline or something to that area. It would need to be a water-based type of lotion or treatment. Take a look at the different types of management, the management of the different side effects, making sure that you're doing a proper assessment, so identifying any problems or risk factors, things that could be going on. So for an example, with enteritis, first thing we would do is assess, identify patterns. Where are they risk for fats, lactulose, bile salts, or vitamin B not being absorbed? Doing that nutritional assessment based on height, weight. What are their normal eating habits? What are changes in eating habits? And looking at signs of dehydration. For treatment for enteritis, we can treat with antidiarrheals, narcotics for pain, and steroid foams to relieve any inflammation or irritation. Nausea and vomiting, this is common for a few hours after radiation. Fatigue, which is common throughout all of throughout all of cancer treatments. This is the most common side effect. Understand that the most important side effect that you should be caring for and focusing on is pain management, but fatigue is the most common. And then you can talk about different types of early and late signs for skin reactions. Again, using only creams or lotions that are approved by radiology or your oncologist because, again, we want to make sure that we're not using anything that has any oils or anything in it because that can cause further burns with the radiation. And then encouraging them to avoid any exposure to the sun. For brachytherapy, side effects for that, swelling at the site, bleeding and burning. Management, we need to observe over time. And then making sure that we're providing distance or shielding from the patient. Brachytherapy is basically radiation coming from the inside to the out, so you need to make sure you and other people have limited exposure to or being around that. This patient should have a private room, making sure that there's precaution signage noted so that people don't just randomly walk in the room without understanding their risk. Keeping a distance of 6 feet from the patient. No pregnant staff, family, or friends should be visiting, and absolutely no children. Again, we're limiting the amount of time that you would be exposed to that patient or to that radiation that would be coming from, again, the inside to the out. Planning and implementation. Treatment is basically dependent on the agent selection, dosage, and cycle of administration. So nursing care, we're going to focus on making sure that they have plenty of fluids on board. So assessing for output, this can include urine, feces, and emesis. And then understanding that bodily fluids when someone is on chemotherapy are considered hazardous for typically 48 hours after the treatment. So certain things people do, double flush, different gloves, specialized gloves that they're wearing, a gown that they're wearing to prevent that there wouldn't be any splashing. So urine, feces, emesis, all of those things, again, considered hazardous for 48 hours typically for a patient that's had chemotherapy. Antineoplastics are the drugs that most common, drugs that prevent, kill, or block the growth and spread of cancer cells, used in combination of other drugs to reduce resistance. And again, understanding this is treatment of the entire body in systemic treatment modality, meaning it treats cancer cells and non-cancer cells, so both types of cells are affected. Non-adjuvant treatment is given prior to the primary treatment, so meaning prior treatment would be surgery or radiation. Adjuvant treatment, meaning they're enhancing the effect of another type of therapy, so given in conjunction with. So that's how they're going to be giving the antineoplastics, either prior to or enhancing the effect of another type of treatment. So the agent is based on the type of cancer and the patient's tolerance to the side effects. The dose is determined by the body surface area, and ideally they want to make sure that they destroy the most amount of cancer cells while producing the amount of side effects. Cycle of administration is really patient-specific, and it varies between one dose to several over days or weeks. And then it's making sure that they give the tissue, the normal tissue, the healthy tissue, time to recover from the treatment. Vesicants are a type of medication that would be given, typically IV, and if it enters the subcutaneous tissue, it causes tissue necrosis and damage to the underlying structures, so tendons, veins, arteries, and nerves. So with the vesicant, we really want to make sure that we're getting the medication in specifically to the patient. So they're commonly going to work with a PICC line or a central line to make sure that it goes directly into the circulatory system rather than being an issue that it could possibly infiltrate. If the IV starts to infiltrate, the vesicant can possibly destroy the subcutaneous tissue and then any surrounding body structures, the tendons, veins, arteries, and nerves. So nursing diagnoses for these: fatigue, altered nutritional status, altered body image, and then risk for injury. Side effects with chemotherapy: hair loss, dry mouth, mouth sores, mucositis, difficulty swallowing, nausea, vomiting, diarrhea, fatigue. Again, understanding that this is the number one side effect, but it's not the most important. Pain is the most important thing that you should be taking care of. With fatigue, you may hear someone talking about having chemo brain, and basically what they're noticing there are changes in concentration or memory. So the treatment for any chemotherapy, so prioritization and administration of nursing care throughout the day. So when you notice someone is having this type of fatigue, you want to make sure you prioritize and administer the nursing care throughout the day. So get done in the morning what's the most important stuff when they feel most rested from having slept through the night. Providing naps if they need that time for breaks or napping throughout the day, and then prioritize or administer the nursing care as needed throughout the day, but really focusing on what needs to be done right now and what could be possibly delayed for later. Other side effects, bleeding and susceptibility to infection. Adverse effects, burning, erythema, ulceration, necrosis, and anaphylaxis. Common treatments for these side effects, ondansetron or Marinol, negretol acetate, sorry. The Marinol is used to increase one's appetite. Other side effects they can also see are myelosuppression, so this is the decrease in the amount of red blood cells, platelets, and some white blood cells. So here you're going to see problems with anemia, thrombocytopenia, and neutropenia. So make sure that you take a look at what are normal lab values for red blood cells, platelets, and white blood cells. What are we doing to treat, or what risk factors would you see with low hemoglobin, low white blood cells, low platelets, or high? You know, understand what are the side effects, what would you be seeing as symptoms, and then what would be your priority or interventions for that problem as far as low platelets or low white blood cell counts. So outcomes here, permanent destruction of cancer cells, remission of the disease, or improved quality of life through reduction of symptoms. So that's what we're going to be focusing on. Again, what were the goals of the actual type of treatment they chose? Long-term implications, people can have problems with nerve damage, so they can have tinnitus or hearing loss. Infertility, so they may want to talk about preservation before treatment, so, you know, saving sperm, saving eggs, what they can. It may cause people to have early menopause. They may see a decrease in the sexual drive, and for women, vaginal dryness. Another long-term implication can be depression. 25 out of 100 patients were noted to have problems with depression during ongoing assessment. So make sure with each follow-up appointment that you're assessing for depression or any problems with, you know, exhaustion, fatigue, anything that could lead to depression. Other implications, fatigue, and then decreased resistance to infection. We want you to focus on nutrition during this time, so really focusing on getting them what they need for those nutritional needs. And different things that can help with this, making sure that they're eating foods at room temperature, providing antiemetics such as Zofran or ondansetron, encouraging adequate fluid intake. Fluids really should be closer to room temperature. You don't want to give anything that's too hot or too cold unless they prefer it, but typically adequate fluids that are at room temperature. We can also add peppermint to food that helps stimulate the diet or stimulate the desire to eat, increase their appetite, and it also can decrease the nausea. So peppermint effective for treatment for signs and symptoms related to chemotherapy and radiation, so it'll decrease nausea and indigestion, decrease the amount of spasms in the esophagus and the intestines, and it can be used to treat IBS related to cramps and diarrhea. Great. Next, we move on to hormone therapy. Here, the goal is to prevent stimulating the growth of any cancer cells at the tumor site itself and those who have migrated or metastasized to other parts of the body. And they can go to surgery to remove different organs, or they can give other medications to help with this. There's a lot of controversy over hormone therapy in the treatment of menopause, and this is because it can increase the amount of, or increase the risk for cancers. So selective estrogen receptor modulators, or SERMs, tamoxifen is an example, so it blocks estrogen from reaching the cancer cells. The problems with this is there are a lot of side effects. So decreased libido, hot flashes, increased risk of other cancers, and blood clots. Aromatase inhibitors block estrogen production. Some types of cancers are hormone response. So as a result of hormones being released in the body, it can promote the growth of other types of cancers. Estrogen, so commonly leads to breast cancer, where testosterone can increase one's risk for prostate cancer. All right. Next is biological therapy, and this uses substances produced by the immune system to fight cancer either directly or indirectly, or to lessen the side effects that may be caused by some cancer treatments. They act by interfering with cancer cell growth, acting indirectly to help the healthy cells, immune cells, control cancer, and helping to repair the normal cells from damage from other forms of cancer or from cancer treatments. This is commonly used or more effective with small cancers, not advanced stages. With this, side effects that you're commonly going to see are flu-like syndrome, so fevers, headaches, and fatigue. So you may see someone with a really high temperature that has confusion, and that can be related to the biological therapy. Next is bone marrow transplant or blood transplant. And this can be peripheral blood stem cell transplantation. It's used to counter the effects of high-dose chemotherapy and radiation, and it's used to treat some forms of cancer. So without healthy bone marrow, the patient is no longer able to make more blood cells necessary to carry oxygen, fight infection, and prevent bleeding. So it's important that people have a healthy amount of bone marrow. So with the transplant, there can be high risks associated with that. So 3 types of transplant. Auto, where we're talking about auto, so the person receives his or her own stem cells that he or she donated earlier. Allogenic, so replacing patient's blood or bone marrow with blood or bone marrow from a donor. And then syngenic, we're talking about bone marrow or blood that's from an identical twin. Peripheral blood stem cell transplantation. Here you're looking at blood is removed to collect specific cells, and then the remaining blood is returned to the donor. So try to remove any type of bad cells or cancerous cells, and then returning the healthy cells. They can also focus on engraftment with this, and after entering the bloodstream, stem cells enter bone marrow and begin to produce new cells. So this starts 2 to 4 weeks after transplant. It can take months to 2 years to work. A lot of risks associated with engraftment, infections, bleeding, problems with the immune system, short-term side effects, nausea, vomiting, fatigue, loss of appetite, mouth sores, hair loss, skin reactions. And then later on, problems again with that immune system, so pneumonia, pulmonary disorders, and viral infections. Graft versus host disease is another problem. That's with the allogenic transplant or transplant from another source. So the white blood cells from the donor are recognized as foreign and cause severe immune response. And we're talking severe. So you're going to see skin, liver, and intestinal problems. Treatment for this is cyclosporine and prednisone as the immunosuppressive therapy. And then, the donated cells, stem cells can be treated to remove white blood cells, and that can occur with this T cell depletion. So a little bit more in depth than what you'll need to know for the exam, but just so you understand the difference of the bone and blood marrow transplantation, and then looking at graft versus host disease, engraftment, and then again the peripheral blood stem cell transplantation. Sorry, I won't keep fumbling over that certain one. So planning and implementation, CAM therapies are really important and very commonly used in oncology care, and we'll go through that a little bit later in the presentation. People are going to go, as medications start to occur or become developed, they're going to go through different clinical trials, treatment trials, diagnostic trials, and then trials through the National Cancer Institute. It's important for people to understand that where a medication is in that clinical trial process. And some people are added into these clinical trials because they're just willing to take a risk on anything. And commonly with the treatment, they're going to have a lot more testing and more closer observation of what's going on with them through that process. So again, they can be looking at different treatments, different diagnostic procedures or trials that they're going through, but just understanding when they're getting involved in a trial and what they need to understand specifically about that. How does their insurance cover it or doesn't it at all because it's not FDA approved yet? So there's a lot of education that goes into anything that has to do with clinical trials. So the National Cancer Institute is the one that commonly works with anything that's going to be cancer-related for medications. They look at 4 different phases for cancer or for clinical trials. So phase 1 meaning just a really small group of individuals, and they're looking at safe dose ranges and identifying different side effects all the way to phase 4, and that's going to be post-marketing studies. So after it's already gone out into the population, general population, what are adverse effects or problems that are occurring over time. Again, education focuses on there's no guarantee for anything. There may be money for the increased amount of visits. There may be extra hospital visits, so you need to make sure you talk to them about that, and then having them check in with their physicians, or excuse me, with their insurance companies to see what may or may not be covered. Other problems, there are multi-system management problems. We look at myelosuppression. I talked a little bit about this before. So 1 or more blood components is low, so red blood cells, white blood cells, or platelets. With anemia or low hemoglobin, we're looking at hemoglobin of less than 12 and a hematocrit of less than 36%. Most common cause is the decrease in the production of new red blood cells by the bone marrow. This causes here chemotherapy because it depresses red blood cell formation. Important to treat, correct the anemia, also increase oxygen so that the tissues have the amount that they need. Other causes for anemia can be bleeding related to a tumor, insufficient iron take, and poor appetite, just because someone may be nauseous or vomiting that they're not getting the right amount of nutrient intake. Signs and symptoms for anemia: fatigue, shortness of breath, chest pain, tachycardia, headache, pallor, and changes in mental status. You may see skin, mucous membranes, nail beds, or conjunctiva, different changes in their lips. Tests for this: iron studies, stool guaiac, liver function, and then taking a look at, obviously, their hemoglobin, just different blood studies, hemoglobin, hematocrit, red blood cell, white blood cell, and platelets. Interventions for anemia or low hemoglobin can be transfusions. Epoetine alpha, which is Procrit, and this is erythrocyte, so increases hemoglobin levels through the erythrocyte CSF agent. So Epoetine alpha, E-P-O-E-T-I-N, and then the second word is alpha, A-L-F-A, and that's called Procrit, is the brand or the trade name for it. For nutrition here, focus on iron, B12, and folic acid. Really, really focus on patient education when it comes to low hemoglobin. Next, we can look at neutropenia. So we're looking at absolute neutrophil count, so anything less than 2,000. This neutrophils are responsible for phagocytosis of bacteria and cell debris. So it's needed to fight infections. So the ANC is usually lowest 10 to 14 days after chemo, and this is called nadir, N-A-D-I-R, and that is usually lowest 10 to 14 days after chemo. So signs and symptoms that you're going to notice: fever, chills, cough, shortness of breath, sore throat, stomatitis, redness and swelling of any breaks in the skin, changes in bowel and urination patterns, flu-like signs and symptoms, nausea, vomiting, and general malaise. If left untreated, it can lead to septic shock, which then can also lead to death. Treatments: colony stimulating factor, or CSF, or Neupogen, N-E-U-P-O-G-E-N. And then they're also going to use broad-spectrum antibiotics to help prevent or fight any infection. This patient would then also be put in neutropenic precautions. Thrombocytopenia is a circulating platelet count of less than 100,000, understanding that normal is somewhere between 1,500,000 and 400,000. And thrombocytopenia, again, usually occurs after nadir, and nadir is that 10 to 14 days after chemotherapy. So with thrombocytopenia, or a low platelet count, less than 100,000, you're going to see bruising, frank bleeding, hematoma formation, occult blood, epistaxis, so bloody noses, petechiae, hematuria, and melena. There can also be intracranial bleeds that can occur from this, so you may see confusion. Patient may complain of headaches, blurred vision, changes in papillary response, and changes in cognition. Neuropathy is another common side effect or problem related to cancer treatments. So this is a condition of the nervous system, so numbness and tingling and burning caused by certain anti-cancer drugs. Treatment of the analgesics taken on a set schedule tend to be the most effective. Cognitive disorders, we talked a little bit about chemo fog or chemo brain, and that can last anywhere up to 2 years. Commonly, 20 to 50% of cancer patients describe changes in cognition through their treatments. So signs and symptoms, inability to find the right word, short-term memory lapses, prolonged learning time, and changes in the response time. Treatments for this are exercise, routine, and then encourage your patients to keep a journal or a log, and then to review that log on a regular basis. Next, we move into the GI system. So nausea and vomiting. Someone can talk about different types of nausea and vomiting that they're experiencing. Anticipatory, so before or during chemo, and it's earlier than expected. This can also occur with radiation. Acute nausea, vomiting, so this is within 24 hours after chemotherapy has been given. Delayed is greater than 24 hours after treatment, and chronic you're going to more commonly see with advanced stages of cancer. So interventions here, keep a log, keep a journal of what could be possibly causing this. Check daily weight, assess for constipation and dehydration, administer antiemetics 24 hours before, and then again 24 hours to 1 week after treatment to help with the delayed or acute types of nausea and vomiting. They can have for antiemetics Zofran, Compazine, Phenergan. Encourage them to drink as many fluids as they can tolerate. Again, room temperature, nothing too hot, nothing too cold. And we can also be adding peppermint to the food and then eating the food at the right temperature or room temperature. Next is mucositis. This is inflammation or ulceration of the lining of the mouth, throat, and GI tract. It's associated most commonly with chemotherapy, but can also be the result of radiation. Really focus on good oral care, eating soft foods, different medications that can help, watch for infection, and decrease the amount of acids. So not using lemon water or using lemon mouth rinses if it does have the actual lemon or acid in it. Diarrhea is another problem. 50 to 80% of chemotherapy agents can cause diarrhea, and this is due to the chemotherapy destroying the rapidly growing cells of the GI tract. Surgery, diet, stress, anxiety, infection, radiation, all those can affect diarrhea or cause diarrhea also. Body image is important to discuss and focus on. Hair loss, wounds, amputation, weight gain or loss, fluid retention, edema, all of those can affect someone's understanding or process of body image. So make sure you're addressing the emotional concerns and issues and find resources to help them out. Next is sexuality. There's major concerns here. It can be loss of desire, erectile dysfunction, pain during intercourse. All of those things can be concerns related to sexuality that can be a result of chemotherapy. Causes here or side effects you're going to see: fatigue, hormonal changes, altered circulation, nerve function damage, certain medications, depression, mastectomies, ostomies. All of those can also affect one's thoughts or issues related to sexuality. Next, we move into sleeping disorders. Very common, about 45% of patients complain about issues with sleeping. And it can be initiating or maintaining sleep, or what we call insomnia. There can be disorders related to the sleep-wake cycle, and then dysfunction associated with sleep stages or arousals, and then disorders of excessive somnolence, where someone is just really, really tired all the time. We want to focus on non-benzo sleep aids, antidepressants, antihistamines, antipsychotics. All of those can be used. And then antihistamines such as Benadryl can also help with an anticholinergic effect. It can help relieve nausea, vomiting, and insomnia. So that's nice that it would help treat 2 or 3 different symptoms that someone would be experiencing. So diphenhydramine or Benadryl is an antihistamine that's commonly used for that. Next is fatigue. We've talked a little bit about this already, but most common side effect associated with cancer and cancer treatments. Really focusing on an assessment here of when, why, and the extent of the fatigue. Treat the underlying cause, so helping them with sleep, nutrition, any problems with anemia. So anemia, again, maybe getting that eposin alpha for the low hemoglobin level. Interferon can be used to treat fatigue, so interferon. And then once done with chemo, typically this will improve, so, but it doesn't mean that it'll always go away completely. Pain is the next one here. So we have 40% of patients do not get adequate pain relief. They're undertreated, and this can decrease their quality of life. So start with an assessment, why, what's occurring, have them describe it. Is it breakthrough pain? Is it intractable pain? What changes that? And then treating it appropriately. And then the final symptom here that we're talking about is coping. So fears related to the diagnosis, death, treatments, loss of independence, financial burdens, pain, side effects of the treatments, all of these can be reasons or issues with coping. So doing an ongoing assessment of stress may impact the patient at different stages. So as they get a new diagnosis or a different diagnosis or new side effects of a treatment, all of those things can change. So frequently be assessing for coping issues, pain, and fatigue. Assess the patients and family and caregivers. All people can go through problems with coping. Individualize the plan of care, ask questions, and allow time for answers. Listen empathetically and empower with information and resources. Next are oncology emergencies. Hypercalcemia. So this is when you're seeing a calcium level greater than 2.65. This happens in 10 to 30% of all cancer patients, and when they have this, it can be a very poor prognosis. Most common in lung, breast, multiple myeloma, kidney, and prostate cancers. Treatment for this, they're going to be giving lots of normal saline and then biofosphonate. Here. Next is superior vena cava syndrome. This results from impairment of blood flow through the superior vena cava to the right atrium because of obstructions or compression. So you're going to see dyspnea is the most common or classic sign and symptom of superior vena cava syndrome. You may also see facial swelling, head fullness, cough, arm swelling, chest pain, dysphagia, headaches, and hoarseness. And typically problems with right-sided heart, right-sided heart death or pain or problems can also be a result of left-sided heart problems. So try and understand exactly what's going on with the right side of the heart. Next is tumor lysis syndrome. And this is a group of metabolic imbalances seen after the initiation of cancer treatments. And it results from the destruction of cancer cells and release of intracellular products. Identify high-risk patients and initiate preventative therapy here. Recognize the early and prompt treatment and responses, including hemodialysis, hydration, diuresis, and treatments of hyperkalemia. And we're going to be treating hyperkalemia with calcium gluconate. Next, we have SIADH, or syndrome of inappropriate antidiuretic hormone. So ADH secretion exceeds homeostatic control and results in increased fluid retention and hyponatremia. They're going to be giving hypertonic saline solutions, so saline at 3%, diuretics, and discontinued drugs that may contribute to fluid retention. An example of that can be morphine. Final thing here is spinal cord compression due to pressure, displacement, or compression of the spinal cord by a tumor. This can also be a metastasis from a breast, lung, or prostate cancer. Monitor for pain, treat pain, and then treatments for this are commonly surgery or radiation, or both. Next, we move on to pleural effusion and cardiac tamponade. So this is an abnormal accumulation of fluid in the pericardial space caused by excess fluid produced by a tumor or pericarditis. Cardiac tamponade is the mechanical compression of the heart. Excess fluid develops or builds up between the heart and the outer sac, so between the myocardium and the pericardium. And treatment here is going to be a pericardiocentesis, surgery, treatment with blood pressure medications, and then oxygen support. Anaphylaxis is next, life-threatening condition due to decreased systemic vascular resistance and fluid leaking from blood vessels. It results in intravenous volume depletion. So this is going to require systemic therapies such as interleukin-1, which can cause severe hypotension, and then immunotherapy. So IgE and IgG antibodies can trigger anaphylaxis also. So making sure that you're looking what is the cause, what's happening. Airway management is the most important. We'll also give epinephrine, IM, corticosteroids, and antihistamines are also our other common treatments. DIC, or disseminated intravascular coagulation. What's happening here is there's clotting in the arterioles and capillaries, so clotting in the smaller blood vessels. So the proteins that control clotting become overactive. And then there's going to be hemorrhaging in the larger blood vessels and in the core. So it's a difficult disease process to manage because you have clotting that's occurring in the micro or the capillaries, the smaller parts of the blood vessels, where hemorrhaging is occurring in larger areas and in the core. Treatment for this is going to be plasma transfusions to replace the clotting factors and heparin to prevent clotting. Increased cranial pressure is next on the list, and this is going to be related more so to cerebral tumors. Sustained intracranial pressure causes compression of the brainstem, herniation, and can cause problems with tissue through the foramen magnum. You're going to see changes in mental status, respiratory distress, low oxygen saturation levels, seizures, headaches, and lethargy. So treatment here are going to be different medications such as corticosteroids and antibiotics, respiratory support, radiation, and intrathecal chemotherapy. Final on this page is septic shock, and this is due to the decreased immune system. So looking at treatment and diagnosis specific to whatever the cause is. So follow aseptic or sterile technique as ordered, and then standard or other precautions that are ordered. Make sure for this treatments include, or assessment, includes blood cultures and lactic acid. We'll also look at ABGs, lab values, so CBC with differential, comprehensive metabolic panel for treatment, looking at respiratory support, fluids, antibiotics, and drugs to support heart rate and blood pressure, sedatives, and then direct treatment of the cause. So here's a list of kind of the interrelated concepts for cancer and cellular regulation, and the exemplars or examples of different types of cancer, specific problems that you could be dealing with. Next, we go into complementary and alternative therapies. This is chapter 15 in your book. Here are your terms. All right, so CAM therapy. So traditionally, what we think of here are going to be Chinese healing systems, where we're talking about the Tao and the Qi. So the Tao is a spiritual belief system based on the teachings of Lao Tzu, and in the essence, it's believed that everything is Tao and the Tao is everything. So this leads to an understanding of oneness in all things in nature. So your life energy is chi that flows through the universe and the person, thus creating wholeness among all things and people. So chi provides warmth, protection from illnesses, and it also provides vitality. So when there's a problem with chi, there can be illnesses or injury that can alter the flow of what's going on or the flow of chi. And this is done by creating an obstruction or block of the flow of chi. So when they're focusing on the chi or enhancing, stimulating points along the meridians, they can focus on acupuncture, acupressure, Chinese herbs, qigong, which is different breathing techniques, shiatsu, which is massage, and tai chi, which is a different type of moving meditation. TAM in Western culture is typically looked at naturopathy, so the practice of assisting in health of patients through the application of natural remedies. So hydrotherapy, herbalism, and naturopathy. In the United States, we look at different types of medicine that are practiced. Most commonly, people are concerned the most common type of medication or therapies that are in the United States is going to be heroic medicine. So this is aggressive medical practices based on scientific principles. We also see different types of CAM therapies, homeopathy, so use of remedies without chemically active ingredients. Osteopathy, which is a full spectrum of treatment. So they're going to use medications, surgery, and manipulation. So those three components are included in osteopathy: medications, surgery, and manipulation or manipulative techniques. Next, there are just kind of the 5 categories of CAM, or complementary and alternative medicine. You're going to see mind-body therapies, biologically based therapies, manipulative and body-based therapies, energy therapies, and finally, alternative medical systems. Mind-body therapies include biofeedback, guided imagery, ancestry prayer, meditation, and relaxation exercises. Here we're going to focus on the way the body functions with mental, emotional, spiritual, and social aspects, and how that affects behavior and health. So here we're going to focus on maximizing the opportunity for health and healing. We're working on the whole person, and then focusing on the capacity for self-awareness, self-knowledge, and ultimately the innate capacity for igniting self-healing mechanisms. Biofeedback is first. So here we're looking at treatment for chronic back pain, headaches, hypertension, and TMJ. This is called the mind-body therapy or mind over matter approach, based on the physiological principle that anyone has the innate potential to influence the mind's control over of the automatic involuntary functions of their body. So decreasing blood pressure, decreasing heart rate, decreasing those pain and things that happen within their body. Guided imagery is the use of relaxation and mental visualization to improve mood and physical well-being. So use of person's own imagination and thoughts to promote mental and physical health, incorporating the 5 senses to guide the imagery. So guided imagery can include some type of smells that they could be, different things that they're touching. So imagine them petting a dog or something like that that tends to relax them. So it's useful for reducing stress, controlling pain, preparing for surgery, and decreasing symptoms of anxiety. Intercessory prayer is defined as a group of individuals that holds their focused thought for healing on behalf of someone else. So sometimes people think of these like a prayer chain, so you're praying for someone else. And we've seen research that shows that it's beneficial in increasing emotional well-being, reducing anxiety, and lessening depression. Meditation is the practice of moving with intention without the sense to, or within the self, to increase awareness of the present moment. So it's going to help relieve conditions such as anxiety, depression, pain, stress, and insomnia. So it's going to be combined commonly with conventional medicine. When it's done with that, it can improve cardiovascular health, rheumatological conditions, and digestive problems. Relaxation exercises help reduce the symptoms of stress and can be used as coping techniques. Exercises range from controlled breathing to stretching, to yoga postures or positions. So commonly you'll see nurses using relaxation techniques such as controlled breathing to control the body's response to different difficulties or different problems that are occurring in life, so pain or anything like that. If I have someone that's getting extremely anxious, I talk to them about breathing in through their nose and out through their mouth, and just really helping them to slow down their breathing, especially if they're getting really panicked or really anxious. So this is a really important tool that nurses can do right at the bedside. If I'm starting an IV on someone and I see that they're extremely anxious or concerned, I can help them with breathing exercises. Next, biologically based therapies. So these are biologically based, so using naturally occurring substances, and include individual biological therapies, so shark cartilage to treat cancer, glucosamine to treat osteoarthritis, different diet therapies, herbal medicine, chelation therapy, all of those. These have not been shown to be effective with evidence-based research at this point. Herbal therapies, medications, or herbalism is the oldest form of care. So using plants and plant extracts to treat different types of diseases and promote wellness. So example here, chamomile, ginkgo, garlic, peppermint, ginseng, St. John's wort. With any type of patient, anytime a patient is taking herbal therapies, a main point that you want to have with them is to ask if the patients are aware of the side effects. So are you having any side effects, or what could they expect, or what are they experiencing? Again, really try and focus on having therapeutic communication. Don't have them feel threatened or like they're doing something wrong, because then it will inhibit them or prevent them from talking about the use of herbal therapies in the future, and then you could have problems with medication interacting with different herbal therapies that they're taking. And then another example here is vitamins and dietary supplements. So calcium, omega-3, folic acid, vitamin B, all those are different things. So it can help with an unbalanced diet. So your cancer patients, this is really common. And commonly they're given in higher than the recommended doses to help the patient get to that therapeutic level. Again, many of the biologically based therapies have not shown to be effective, but there are obviously some that have proven to be. Calcium, using that for bone strength. It can also be used to help with insomnia, so helping someone to sleep better. All right, next is manipulative and body-based therapies, acupuncture, acupressure, chiropractic, massage, shiatsu, rolfing, tai chi, and yoga. Acupuncture is a group of thin needles that are manipulated by the hand or electrical stimulation inserted into different parts of the body. And here they're going to assist with promoting the flow of qi along the pathways known as the meridians. Acupressure is using consistent and firm pressure from fingers or other devices. We can also use antiemetic armbands that are applying specific applying pressure to certain acupuncture points on the wrist that have found to be effective. So acupressure in the common acupuncture point. I want to make sure you understand what I'm saying, because I have, again, my nasal stuff going on. So these type of things, acupressure, really common in decreasing nausea for both pregnant people and people that are going through problems with chemotherapy. Chiropractics is next, and this is the next, and it's the deliberate and specific manipulation of the spine to improve the patient's health. It can also be used on different parts or different joints within the body. This is relatively safe, drug-free, and non-invasive typically. For the treatment of back pain, neck pain, joint pain, problems with arms or legs, headaches, and other neuromuscular complaints. This is proven to be effective commonly for headaches mostly, and acute lower back pain. So there is proven research there. Massage is the manipulation of body tissues to promote wellness and reduce pain and stress. It involves a variety of light touch and deep touch techniques. So stroking or kneading and applying pressure to specific points. This helps with stress, anxiety, pain. It also improves circulation and improves alertness. It can enhance sleep patterns, release endorphins and relaxation, and increase oxygen supply. Massage can also help reduce the heart rate and blood pressure and increase energy and increase our immune system activity. Next is shiatsu, and this is a combination of acupressure, massage, stretching, and joint manipulation. So it's going to focus on it's focusing on unblocking the qi flow by the application of pressure and massage along the specific meridians. Typically here someone is fully clothed on a low bed or on a floor mat, so it's a little bit different than a massage. Rolfing is the next one, and this is a form of deep tissue massage and manipulation to correct body posture. The Rolfer focuses on one specific body part and applies pressure to loosen the connective tissue or the fascia. So this results in lengthening and relaxing of the fascia. Tai Chi involves concentration, strength, flexibility, breathing, and the use of symbolic movements. So this is a moving meditation with the goal of gaining balance in the mind, body, and spirit. Last in this is yoga, and this combines physical postures, breathing exercises, and meditation with a distinct philosophy. Yoga is intended to increase relaxation and balance the mind, body, and spirit. As nurses, what we can do is encourage patients to participate in yoga by finding a local organization, local teacher, or different training programs. Next is energy therapies. Reiki is the first one here. But understanding energy therapies is the premise of energy medicine, that all living beings are comprised of energy and organized into intelligent, self-regulating network of vibrations and frequencies. So energy therapy focuses that the person function optimally and that their energy flows freely and with vitality. Reiki is the use of physical, emotional, and spiritual healing. The practitioner does not use his own energy, but rather acts as a conduit for the universal energy to flow into the person. So taking what is in the universe and it's going through the practitioner into the patient. So they're typically using laying down of hands over 7 chakras of the body, and they can do this both anterior and posterior. And this is helping the flow of energy through the chakras, opening the energy flow in the individual so that he or she might be able to heal. Next is therapeutic touch. It's based on the theory that the body, mind, and emotions are complex energy fields, and that we're trying to promote relieving tension, headaches, reducing pain, speeding the healing process, reducing stress, and improving the immune function through touch. So nurses here doing a foot massage, a hand massage, touching the patient's shoulder as you're listening to different, their lung sounds or their breath sounds or heart tones, different things that you can be listening to, but just providing that physical touch, knowing that the patient isn't someone that isn't cared for, isn't loved, and those type of things. So we're just really trying to help promote that person's emotional well-being during and through therapeutic touch. Last, we have alternative medical systems. We talk about homeopathy, naturopathy, and osteopathy. Homeopathy seeks to stimulate the body's ability to heal itself by giving small amounts of highly diluted substances. So here the substances are required to be FDA standards in strength, purity, and packaging. However, they do not they do not undergo the same testing or clinical trials for safety and efficacy as our prescription or over-the-counter medications do. Naturopathy focuses on supporting health rather than fighting disease. So treatments are hydrotherapy, manipulation, dietary changes, herbal medicine, counseling, mind-body therapies, and exercise therapy. And last is osteopathy, so manipulative techniques along with medications and surgeries. Osteopaths practice in all fields of medicine, and they are fully licensed physicians, but mainly focus on musculoskeletal problems. Osteopathy differs from chiropractic because of its underlying theory that it is impairment of blood supply and not nerve supply that leads to the problem. Other types of CAM therapy include humor, music therapy, and spiritual therapy. I believe that is all. So if you have any questions, please don't hesitate to contact me via email or during my office hours. Thanks a lot, guys. Have a great night.